Have you heard of BodyAccel's? We haven't. And there are so many companies and brands now. I mean, how can you keep track of all of them? But we recently had a comment on our YouTube channel to discuss BodyAccel's. So we thought we'd address it because there are some interesting components and blatantly false advertising claims to the point it makes you wonder if this company thinks consumers are stupid. Hello again. I'm Dr. Rob, accompanied by Tammy, and you're listening to the Dental Formulators Playbook.
Body Excel. I haven't heard about them. So who are they and what do they sell?
So I hadn't heard of them either, but I have heard of some of the ingredients they are using. We'll discuss that in a couple formulations, but first, Body Axel.
Wait, don't tell me. A dentist owned company.
Yeah, another one. Apparently, it is dentist owned, and the dentist is based in Los Angeles. And, again, we're not throwing shade on dentists, but I am throwing shade on brands and companies that purport to be science based or science backed, yet don't have relevant testing in hand and make outrageous claims.
Do tell.
So there are many issues with Body Accel. You can literally start anywhere. For perspective, let's look at their About Us section on their website and let the listener decide.
Sounds good.
They have a statement about harsh chemicals. Okay, they call them quote unquote harsh chemicals. They say, and I quote, we're anti chemicals, pro natural ingredients. Our products are free from parabens, sulfates, and fluoride because your mouth deserves the best, not the harshest. End quote. So keep that in mind as we move forward with all of these ingredients that we will be talking about, and we have at least two formulations.
Okay. So at minimum, the product should not include sulfates.
Yes,
But let me guess. They include sulfates.
absolutely they do. In fact, it's in their toothpaste. Now look at, I know I'm already coming out of the gates throwing shade on them, but this sulfate claim, this is just the tip of the iceberg. Just wait and and you'll see. But anyway, okay. In my view, starting with just the sulfates, this questions the legitimacy and honesty of the company and their products. So now let's look at the ingredients in their signature product called the Niacinamide Whitening Toothpaste.
Okay, let's do formula forensics.
But there is a big problem.
Okay.
Huge problem. I haven't seen this before for so many products sold in the US. I'm sure there are. I don't have all day to look at the thousands of brands and thousands of companies out there, but this was the first time that I actually saw that the ingredients are not consistent for the same product that's featured on their website and that is found in the Amazon listing. Not only that, but the images that Amazon has of that product in their list is not the same.
Okay, I'm not understanding.
Yeah.
I'm not understanding. So the ingredient lists are different, even though it's supposed to be the same niacinamide whitening
Nice.
toothpaste.
Yeah, that's right.
Seriously.
Yeah. So again, the company has serious issues, including label consistency. So I have to ask what's really in this product? Which ingredient list is correct? And by the way, even if the product on the listing shows different ingredient listings, like one is in the image and then one's further down in the product description, which one do you go by? Anyway.
Yeah, seriously. But this company is apparently doing well on Amazon, selling like 6,000 monthly units. This is not a small volume.
No, it isn't. And this is one of the reasons why I don't mind addressing this specific company or the products in this show because somebody needs to do it. And wait till we go further here.
So first, let's talk about the website and Amazon material description ingredients, which are essentially the
They
same.
are.
Then we'll talk about the other ingredient listings shown in the images.
Yeah, which are a little bit different. Yep, sounds good.
So first, although the toothpaste says it has niacinamide on the tube, this is not actually listed in the ingredients.
That's right. They don't list it there, but let's assume that it is. Okay, so let's talk about niacinamide. So this is what would be more familiar to our listeners as the water-soluble vitamin B3.
Okay.
B as in boy, 3. It is used in the synthesis of NAD+, and NAD+ is important because it plays a fundamental role in all of the cellular metabolisms. And so from that point of view, it's important for there. So we don't know what the loading level is because they don't list it in the ingredient. I don't know where in the ingredients it is, and they don't bring attention to it as even anything. It's part of their label. They just say, hey, this is niacinamide whitening toothpaste. If we're going to try to assume what the loading level would be, I think I would have to default to what the recommended daily intake, or at least the upper limits of vitamin B3 would be. And so, most doctors would say, well, you don't want to exceed 1.5 grams per day. Usually doses are given maybe about 500 grams, but you don't want to exceed 1.5. Then let's use that in terms of weight percents for a given toothpaste formulation, because that's how that's done by weight. I would say that it would be anywhere between 0.5% and up to 1.5% by weight. Now, that might be a reasonable level if somehow the toothpaste was ingested, right? Because sometimes people who don't have fluoride in their products, they say, hey, look, this is safe for ingestion. BodyAccel is not saying that to the best of my knowledge and what I was looking at. But let's just say it was somehow ingested. As long as it has up to no more than 1.5%, then it'd probably be okay. If you ingest too much, you're going to have nausea, you're going to have stomach problems. There are some other things. But I think that it's important to understand. I mean, even doctors will tell you, there is such thing as too much of a good thing. We go back to Paracelsus, right?
Right.
The dose makes the
Poison.
Exactly. So, too much of a good thing is going to be bad. So here, if you have something introduced into your mouth and it sits in the mouth, whether it's a drink that you're drinking, whether it's toothbrushing, whatever, you can have up to maybe 12% absorption systemically going through the mucosa, through your cheeks, through just the natural act of swallowing, tongue, just things like
That's why they
that.
say digestion begins in the mouth.
Right. So that's one of the reasons, exactly. Now, think about if you have somebody who's already taking vitamin supplements. And so if somebody is already meeting or even exceeding a little bit that threshold of vitamin B3, and all of a sudden now you're introducing a toothpaste that has additional B3, there could be some counter effects then that you might be experiencing. So I think that it's really important not to overload yourself with these vitamins. And the fact that they're not clear on what that level is doesn't speak really to the safety part of this. Even on a multivitamin, damn it, you have levels and how much percent of the RDA. There's nothing here. They don't even list it. So I think that caution has to be had because, again, too much of a good thing can be a bad thing.
Absolutely. So even though it's in their name, it's not even listed in the ingredient panel. So we don't know how much. And ingestion, including that inherently absorbed by our oral mucosa, could lead to issues.
Yep.
So let's go to the next ingredient. And this is listed.
Yeah.
Sorbitol.
Sorbitol. So that's your standard humectant and sweetener for toothpaste. I know, we talked about some mouthwashes in prior episodes. Sorbitol is like one of those, you got to have that in your toothpaste usually. Usually it's combined with glycerin and water if it's going to be a water-based system. But sorbitol is one of those very, very familiar, recognizable ingredients. It's a humectant, maybe adds a bit to the sweetness profile, but not a whole lot. And it maybe is up to 30% into formulation, usually around 25, maybe a little less.
Ascorbyl.
Yeah, here's an example where they're being cute. And it could be acute, or maybe they just had a mislabeled thing because it's not just ascorbyl. Although if you were to search this, it comes up. What this refers to is a salt version of ascorbic acid, which is also known as vitamin C. Okay. So they probably are using sodium ascorbyl phosphate. And they do this because it's a more stable version of vitamin C. And maybe you can try to minimize some of the unwanted pigmentation that comes with vitamin C, or I should say, ascorbic acid has a little bit of a tinge. And ascorbic acid is going to be a bit more reactive. So there might be other reactions with other ingredients that you don't want to have in the formulation. This is especially popular with sorbic acid, for instance, potassium sorbates. They can react very strongly. Usually they're in flavoring systems. And then usually you have to counter that by adding another ingredient to mask that discoloration. Sometimes you have to put
one
in
thing
more.
on top of another.
Yeah, so it's just one of those things. So I think that the use of sodium ascorbyl phosphate, I think that that's good. I think that's clever. So I'm going to give a little bit of that because you don't see too much of that. However, it looks ridiculous if you see it on the ingredient level. So if you see sodium ascorbyl phosphate, does that seem natural to you? It just doesn't even read natural.
And so put vitamin C.
Yeah. So I don't know, but anyway, where this is occurring in the ingredient listing is like right after sorbitol. So you have sorbitol like maybe 25%. So how much really do you think that you're having here with this ascorbyl? Do you think it's 20%, 10%? No, probably not. No, it's probably much less than 1%. So again, this goes back. They have significant labeling problems with their products. The consistency is a problem. And I think if they can't get that figured out, which they can't, then you have to be careful. Or won't. Yeah. I mean, they're obviously selling on Amazon. And, again, this speaks to the oversight. Amazon's they cannot police. It's like the FDA. You don't have enough regulation. It's just not there right now. This is still, again, folks, the Wild West in formulations with access to all these different channels, one has to be careful.
Yeah, I agree. I just have to say, I already hate this company. And we're only 3 ingredients in.
Yeah, wow.
Okay, so the next ingredient, which is usually much higher on the list, but for some reason isn't, is water.
Yeah, that's your base, right? So we know this is going to be a water-based formulation, maybe up to 50%. That's typically what it has been in the past. We think that it's probably there, but I have no idea. It might only be 20% for all I know. Maybe this is, who knows?
Lactose.
Yeah, so this is a problem. This is a milk-based sugar. Let me reiterate that. This is a type of sugar. It's a
That's
sugar.
allowed in toothpaste,
No,
right?
no. No,
A minute.
no, it's okay, and it should, and I want the listeners to actually just dwell on that for a minute.
Okay, sugar in a toothpaste.
It's
That's great.
not, while that might be something that you might experience outside the US, in the United States, even if it's a cosmetic and not necessarily considered a drug, if you're using a toothpaste, it's generally recognized as good practice and frowned upon if you don't follow this, that you do not put sugars in your oral care formulations. And why? Because sugars and fermentable carbohydrates, they are readily fermented by the microbes that live in our mouth. They produce the acids that then lead to the demineralization of tooth structure, also known as dental caries. This is just one of the issues. So they have lactose. What do you think about that?
I think it's unbelievable. So, what do you think the level might be then?
Well, I think they probably added this for a sweetness profile, because I don't understand why you wouldn't do that. So it could be as little as 0.1, but shoot, if they want something really sweet and they got to mask other ingredients, it might be a lot higher. I hope it's not. But even if it is or isn't, lactose is often derived from milk.
Yes.
And they promote their products as being allergy-free. Well, then they should at least put a warning on the product that says, look, if you have milk sensitivities, you should avoid this product. So even if everybody were to accept, hey, it has lactose and, Dr. Rob, who cares about, what the sugars and everything? Okay, fine, whatever. At least put a warning on. And again, you're being inconsistent. You're saying that you're allergy-free, and yet you have a potential allergen in there. This goes with anyway, I don't want to.
Yeah, just so frustrated right now. Okay, so that's, again, a bit unbelievable. So I'm going to go to the next ingredient.
Yep, go ahead.
Cocos nucifera oil, or coconut.
Yeah, they got to sexy it up, right? So it sounds better if it's nucifera oil, it's coconut. Now, here's the thing. I don't know why they added this, okay? Usually in formulations, you want to try to give that, maybe for a marketing appeal, you want to put some coconut in. But I don't understand why it would be in here, and I don't understand the level, because it's an oil, and water and oils don't mix. So unless you have a really potent or creative emulsifying system that can try to bring in those oils and make them mix really well with the water. Again, we don't know how much, because it's just all of a sudden appearing, right, in the thing. So we don't know. I mean, it could be 10%. We have no idea, but it could be as little as 0.05%. Who knows? But we'll see if they have any kind of binder or emulsifier in this formula.
Okay. Next, hydrated silica.
Yeah, so this is a pretty standard inky name, INCI, and this usually refers to either a thickening type of silica, and the thickening type of silicas can still leave a gel or a dentifrice looking maybe translucent. It won't look opaque. If you add an abrasive type of silica, which is also considered a hydrated silica, then it'll appear probably more white or reacts more with the surfactants, which by themselves dissolve in solutions and are generally clear, but they tend to give a white type of formulation look. So
it's a good distinction.
Yeah, so one of the reasons why everybody thinks of toothpaste and they think of it as white is you have to think historically, and you think, well, what is your typical abrasive? What is your typical surfactant? Silica, abrasive silica, or, with respect to the surfactant, sodium lauryl sulfate. Those combined give you that whitish kind of pigmentation. Okay. If you want even whiter, then sometimes you put in titanium, and there's some other tricks that you can do. But that's usually the reason why toothpaste would traditionally look white, is because of that.
Okay.
Maybe 2% for thickening. For abrasion, you can go maybe as high as 7%, but we don't know. We don't even know if both of them are there. If they have a clear toothpaste, then they might not have any abrasion silica in there, or they might have very little in there, not like 7%. They might keep it really low.
But for people that might have sensitive gums or something, the abrasion, the RDA, I think we've called it before, relative dental abrasion, would matter a lot. So
yeah, it would.
Disclosing it would definitely
help. It'd be really nice to see any kind of testing. What is not only the abrasion, but how well does it clean? So we would also want to look at the pellicle cleaning ratio, the PCR.
Okay.
That combined with the RDA, man, gives you a bang up idea on how gentle is this, yet how effective is it for cleaning.
That makes a lot of sense.
Yep.
Okay. The next one is PEG 400.
Yeah, so this is a longer chain form of polyethylene glycol. Sometimes in the mouthwashes, we've seen polypropylene glycol, for
Hmm.
instance. But this here, this PEG 400, a little bit longer. It might be one of those ingredients that's used for mouthfeel, but it might also be used to help solubilize some oils. Maybe like the coconut oil, maybe some flavor. I don't know for sure, but you don't see this a ton with certain formulations that have some of the other ingredients in there. I don't know about coconut oil plus not to say that it can't happen, but I just haven't seen a lot. And I don't know how good it is at really folding those oils
Okay.
into the formulation. But anyway, it's probably between 1 and 5%.
Sodium lauryl sulfate. This company specifically says they tout themselves as being sulfate free.
Yeah, and they don't like harsh chemicals. And by the way, PEG 400, that's synthetic. Like that's not even natural. So hydrated silica, you might get, some certification that being natural, it has to be made synthetically, like it has to get the grades that you want. So again, they're inconsistent with their messaging and they're all over the board. But on the About Us section of the website, that's where they're claiming sulfate free. Okay. So if anybody's going to check, oh, I don't know, it doesn't say that on the thing, it won't say it. Okay. You got to go to the website, you got to go look at the About Us. And the guy says he's, so desirous to
Whatever.
have all these different products, whatever, who isn't? Anyway, the level of sodium lauryl sulfate probably ranging from 0.3%, which I think would probably be pretty good, all the way up to 1.5%, a little bit more foamy and a little bit more aggressive. One has to watch for that. So anyway, by the way, sodium lauryl sulfate in general, I know it gets a lot of shade, but that was one of the original sodium, surfactant systems. I think we talked
Hmm.
about that in one of the prior episodes. But it's also pretty potent at reducing plaque. So it's a good cleaning agent. I mean, this is your dish detergent that you use to clean your dishes. I mean, it's also in there too, and it gets the grease off. So if it's going to do that to your food particles and grease on the dish, it's also going to do the same thing in your mouth too. It's going to clean.
But it's usually at low enough levels that it's
Yeah, dish detergent,
not,
it's going to be higher.
yeah, it's
Yeah.
not an issue. Okay, so just for the record, I'm liking this company less and less. In fact, I think so far it's crap. Next ingredient is glycerin.
Yeah, I know, right? So we have some glycerin. That's another key humectant for toothpaste. Again, usually accompanies sorbitol, maybe 20, 25%. Mislabeling confuses that. So it could be as low as 5, 10%. Who knows?
Okay, so of course, one of my favorites, flavor.
Yeah, another loaded one. So I'm guessing the flavor could be up to 0.5%, but depending on what's called flavor, this might also have some preservatives that they don't claim or want to have in their product. It could even have some parabens. I don't know.
Which they say they
Which
don't.
they say they don't, yeah, but it might have it, or it might
Right.
even have alcohol. And by the way, they also say, hey, we have alcohol-free formulations, and that's what we like. Some of these flavors are better solubilized and have a
Yes.
more potent punch, especially menthols and stuff, if they're in terpenes or in alcohols, things like that. So.
Good grief. Okay, xylitol.
Yeah, so that's probably for sweetness. Yeah, they could probably use it for humectant purposes at that level of like sorbitol and glycerin, but probably for sweetness, maybe up to a couple percent. You only see that on the label, but if you actually go to their website, they don't refer to it as xylitol. They use a word, actually, I didn't even know that this was referred to. Newtol, Newtol.
I haven't heard that.
No, and it's a synonym for xylitol.
I
And
had no
but
idea.
nobody really knows this. Maybe it's a brand name of a Xyloto. I don't know. Who knows? But this is clearly meant to be a marketing ploy trying to draw attention to a quote unquote hero ingredient to say, hey, look, we have xylitol. But they're not going to call it xylitol. They're going to call it something else. So again, you see this in some of their marketing. Okay. It
Okay.
may not necessarily be on the product packaging,
Right.
but it's there and they're trying to be cute. Look out.
Okay. Tetrasodium pyrophosphate.
Yeah, we love this ingredient. This is one way that brands make plaque removal or anti-stain claims. So
Okay.
you could put this ingredient in, it really acts to help, grab really and chelate those calcium and phosphate minerals and salts that just happen to precipitate on top of the tooth. So this is more of a problem for those that have more of a basic kind of oral environment, more alkaline. Maybe they use more sodium like baking soda.
Oh, baking soda.
Sodium bicarbonate
Yeah.
and stuff if they have, or if their natural pH runs a bit higher. So for those that are more prone to caries, you might have a more acidic environment just natively. Can this be adjusted? Of course, through your diet and your hygiene and stuff. But for those that tend to have inherently a more basic kind of oral health profile, those are also going to be the same people that suffer from bad breath. So you're going to have more of the likelihood to have the tartar, to have the buildup in the mouth. And so
Okay.
pyrophosphates are usually added to help combat that. If you have a product with that has fluoride, you might experience less fluoride uptake into the tooth. That's a little bit different and it has a different conversation. But just to let you know, the pyrophosphates can work well with fluoride, but it might inhibit some of the benefits of fluoride in those formulations. It can, not always, but it can.
Has to be well
Yeah, so it
formulated.
has to be well formulated. So anybody who's dabbling in pyrophosphates, they tend to know what they're doing. I don't know if this company knows what the heck they're doing. Okay, because obviously fluoride's not there and they're throwing it in, and this is just only one of the issues that we're having with this. But it is not a natural product. This is a synthesized material. Again, this is a chemical, and you have to be careful because if you have the loading level too high, it'll be more aggressive in its action in the mouth than sodium bicarbonate.
Oh,
So there's a concern that it could lead to gum irritation. Some people don't like sodium bicarbonate for that very reason.
right.
They might say, like, I'm one of them. I don't like it. It makes my gum tissue feel like it's raw.
Yes.
Some people can get canker sores and they just don't
Mhm.
like it. Although those formulations also have sodium lauryl sulfate, and everybody points, oh, it's a sodium lauryl sulfate. It probably isn't
Right.
because of the sheer ratio and how much bicarbonate that is there. There can be some issues there with tartar, with gum irritations. And by the way, tartar and calculus do lead to gum irritations also. So
Right.
having this kind of pyrophosphate ingredient is a great idea. The problem is we don't know how much. Again, they're not labeling it clearly, and we have to worry that it's not at that level where it could by itself lead to irritations in the mouth.
I feel like this is smoke and mirrors or that
Yeah.
ball under all the cup games. Like, is this ingredient in it or
Yeah,
isn't, or
and
what
this,
is it?
and this is one of the reasons why there are rules, right? Even for
Yeah.
cosmetic, put your ingredients in descending order. Again, this is for safety. This is
Yes.
for knowledge base. We're not saying this has to be, we're not even talking about efficacy right now. We're just talking about safety and knowledge and just what's in my flipping toothpaste, dude? Like, come on.
Okay. Next is sucralose.
Yeah, for sweetening benefits, probably up to 1%, maybe a bit more.
Okay. Well, that's the list on the website and Amazon product listing. But I noticed there are other ingredients listed in the Amazon images. For
Yep.
instance, menthol.
Yeah, so that's a flavor purposes. I don't know whether before they just lumped that into fragrance. I don't know why. I don't know why, first of all, they would call it fragrance, but because it's not a skincare cream, you know what I mean? It's like it's not, you don't do that unless you're trying to be cute. Menthol, that's a fine flavor agent. That's fine.
Okay. They also list sodium phytate.
Yeah, so this is a chelator, and this is supposed to be a
Okay.
natural derived ingredient. I don't know about that. Usually these things are synthetic because it would take a lot of plant material in order to get to that
Right.
endpoint product, but probably not used more than 1%. I think it's again going to help with plaque and cleaning because that's what EDTA does, and that's also what sodium citrate does. So they help to grab those sometimes like if it's easy to talk about iron. It chelates and grabs the iron.
Right.
If you have some kind of staining agent that might have similar characteristics where it can be grabbed, it'll also do that too. So
I always remember
yeah,
it, chelator claw, like
yeah,
hard, and
chelator.
it keeps it. Next is papain.
Yeah, so we discussed this in earlier episodes for whitening, so you have to go back a little bit. But this is essentially papaya's version of the pineapple-based protein used for meat tenderizing, also known as bromelain. So both papain and bromelain are protein-based and chemically dissolve the protein-rich pellicle layer. Remember, like dissolves like. And it's the pellicle-rich layer that oftentimes holds the stain. And so, if you can destroy the pellicle, which is put forth down naturally by your saliva on the teeth, then you're going to have a whiter smile. So, having an agent in there to bust up that staining, yeah, it makes total
Makes sense.
sense. But here's the issue: we don't know about the potency of this papain.
Like the
And
load level.
yeah, we don't not only the load level, we don't know how many dissolving units per gram are there in this papain. So there's some manufacturers like Selco, SELCO, that will sell papain at 200,000 dissolving units per gram.
Okay.
Hugely potent. Then you have other ones, you can buy these on Amazon or elsewhere, that have as low as 2,000.
So huge variation.
Huge variation. And that also then necessarily impacts loading level. So, like for the 200,000, you don't want to use more than 0.3%. Unfortunately, you have dental researchers, I've seen papers on this, they don't pay attention to that use. they'll do a whitening experiment. I think we already referred to it back in the other thing, and they'll put in 1%. So you have 1% of a 200,000 dissolving unit per gram
Wow.
papain that's hugely, hugely potent. It's going to start having deleterious effects, damaging effects on your gum tissue, because your gum tissue is also comprised a bit of protein in addition to the to the collagen and such.
You said
So
it's like a meat tenderizer.
it's like a meat tenderizer. So you have to
Oh,
worry about how much that is present. What is the, what is the strength of this?
wow.
And then how frequently are you brushing? And then how are you brushing? Are you using an electric toothbrush where you're driving that shit into your gums? Like, I don't know what else to say. And I, apologize for the profanity, but there's a lot that goes into a properly well-designed formulation. And because of some of the other issues that we're having with the labeling and just blatant misrepresentations, you have to wonder.
Well,
And
yeah.
and again, this is selling well on Amazon. So this is why we're talking about it, because this is stupid,
There's
actually.
such a lack of transparency
Such a
here.
lack of transparency.
And I honestly don't have any confidence that they understand the differences
No,
at this point.
they probably have contracted this out. It might not even be made in the US. It might be made overseas,
Mostly not,
maybe in
because
China and stuff. And
yeah,
they're thinking, hey, we'll just make this and then you'll have it. And
Would-
oftentimes, the dentist-owned formulations, this might be a revelation to some, they don't even own the formula. They know what the ingredients are, but they
Right.
don't even know the loading level.
right.
And that's true even here in the United States.
Yeah.
There's manufacturing companies that do not allow the brand to actually own the formula. You can, but you got to pay a fee. It's reasonable because work went into that. That is actually a form of intellectual property. Designing an effective formula that actually works, that's valuable.
Absolutely.
So, but if the entrepreneur, if the brand or whoever doesn't want to pay for ownership of that formula,
of course not. They would align their pockets.
then they're not going to know. So it's very possible that even the owner may not know exactly what is in the formulation.
That's a little scary. Maybe that's why their lists are all over the place.
Maybe.
Okay, so finally, they also list microcrystalline cellulose. Again, not on the ingredient panel, but it is on the product image.
Yeah, so this, I'm guessing that this is probably the binder. Maybe they use up to 2.5%, maybe more. Again, we don't know because we don't know how much coconut oil, we don't know how much water, we don't know how much PEG 400, right? We have no idea about this stuff. But I need to stress that this is a very cheap ingredient, okay? So overall, whatever the price point of this product is, every ingredient that we have discussed is relatively inexpensive. There is nothing here that would cause for jacking up the price of the toothpaste. Moreover, I haven't seen any safety or efficacy data. So that price for all that testing and stuff is not included in the formulation. I don't know what anybody is paying for.
That's good to know. A lot of times, some of your better brands, especially with newer items, sometimes they do have a slightly higher price point because they put the time and effort into conducting those tests and those studies, which are very expensive, and they try to, mitigate some of that cost. But it doesn't sound like that's what this company's doing.
Yeah, we don't know anything about the potency, including how well it whitens. I mean, you can get just general whitening from just brushing your teeth with a toothbrush and any general toothpaste.
Right.
Why? Because it tries to remove the plaque and any of that pellicle that resides with that. I mean, if somebody just had a drink of wine or some coffee, or they had a cupcake with blue food dye,
Right.
in the shape of a Smurf or something. You eat the Smurf and all of a sudden your teeth are blue. If you brush your teeth, guess what? They're going to get less blue. That's a whitening event. Sorry. And so a lot of times companies will do this. Boca is one of the biggest offenders of this. They don't have any data of their own. They just say, well, yeah, I mean, our products whiten the teeth, but they don't have any data. And it's because they know, and this is how they explain it. Well, yeah, it's just the action of the whatever abrasive you use and whatever toothbrush. Yeah, we know. But again, the point is they don't have any testing. So I don't know. We just don't know anything about this.
So this product is pretty weak performance-wise and uses basically the lowest amount of quote-unquote key ingredients just for the sake of marketing.
Well, hopefully, I'm hoping that they're not putting too much niacinamide in there. The last thing we want is, somebody, and it, won't affect you till a little bit later. Well, I don't know why I feel nauseous. I don't know why my stomach's getting, yeah, I don't know either. But anyway, yeah, so we have inconsistencies. We have whether it's the labeling, whether it's the statements, they also have other issues, by the way.
No, wait, there's more.
Of course there is. So for instance, their website lists FDA approved. What? This is false, okay? Because the FDA doesn't approve cosmetic toothpaste.
You said they didn't want to have fluoride, right?
Yeah, they don't even approve that at all. It's not like there's a formal recognition. It's not like they said, okay, here, FDA, here's our dossier on this formula with all of our safety and efficacy, and here's our formulation. And every adverse event that we've experienced in the course of our thorough testing, please,
Which they haven't done.
let us know if this is approved. There was no filing like that. There was nothing like that. This product is not FDA approved. You don't have to do that. This is a stretch and it's inappropriate and it's wrong.
Yeah, the list of issues is growing and getting worse.
Yeah, it is, isn't it? Yeah.
Okay.
So,
Next, they're going to list this toothpaste as a quote unquote anti-sensitivity toothpaste, but I'm just gonna guess they don't have clearance for that
so
either.
we just talked about all those ingredients, right? Did any of those ingredients, okay, I'm going to ask you, did they have potassium nitrate? Did we
No,
talk about that? No. So did they have stannous fluoride?
no,
Did they have any fluoride?
no,
Okay. Did they talk about receiving medical device clearance for sensitivity?
no.
Okay. But all of a sudden, they're talking about anti-sensitivity all over their website.
You can't
So
do
where's
that.
the sensitivity relief coming from? I
Not only do they not have
we
studies,
have
but you have to get clearance,
Yeah, you have
correct?
to get clearance. This must be an amazing product, right? I mean, they've done a bang up job, right? What else about their product? What else does their website say?
They don't have any they didn't do any studies. They have never tested this product in the laboratory or clinical settings, right?
Right, right. And
Okay.
so
But their website says, quote unquote, science proven and quote unquote 100% safe.
100% safe, right? So I don't agree with any of their statements. Now, look,
Well, they can't prove it.
well, they can't prove it. Now, they'll show, maybe like some kind of certificate that says, hey, we don't have microbial contamination or heavy metal contamination. Usually that's done by a responsible manufacturer, right? After they make the dose, they test for, hey, did any of the ingredients have microbial contamination? Like, was there any
Go to the
fungus?
farmer's market, that's required.
Well,
That is like the
that's a
absolutely
yeah. Well,
lowest
that
criteria.
yeah, great point.
Oh my gosh.
But they don't talk about safety. They don't talk about efficacy. In that same vein, where they're trying to say this, they say it's FDA approved. And again, there is no FDA approval for this. This is out of control. They would only say FDA approved if they actually went through the process of filing a new drug application, which would require the attendant requisite safety and efficacy data, voluminous amounts actually, not
Yeah.
just, hey, here's a study and here's a study. You would actually have to do that. So, no, they are absolutely off the wall.
Wow. Okay. So I think this company and these products are highly dubious at best. So buyer beware, right? You wanted to talk about another product of theirs, though, right?
Yeah, I want to, they have a whole line of products, right? Of course they do. You have to, right? But I want to talk about specifically their mouthwash because this has even more issues.
You mean more issues than the sulfate-free toothpaste that has sodium lauryl sulfate?
Yes, and more
That's
egregious, actually.
no. I
Yeah,
wait. I do have a screenshot of their product's main ingredients.
good.
Oh, you're gonna have issues with these. So the first main ingredient
I know.
is natural honey extraction,
Good God.
precisely targets and restores periodontal tissue.
Hallelujah.
Holy cow.
Hallelujah. They have figured out how to restore periodontal tissue. Damn. Without having a drug claim, without having a drug application. I am in awe, right? Notice how they use main instead of active. They have some scruples, okay? Maybe a little, maybe it's a little low. I just,
They're just trying to
oh my God.
skirt the issue.
Yeah, so they're calling the honey extraction. Usually you'll see this in the formulations. Again, not too common in the US, but everybody likes to try to look at what's going on outside the US and try to bring it into the US, right? Usually this ingredient might be called MEL, MEL.
Okay.
And, just for clarification, this is not part of the bee propolis. The natural honey extraction is actually coming, and it's actually sugar based. So again, we're back to having sugars in the damn formulation. I don't care if it's lactose. I don't care if it's MEL. These are sugars. It's disallowed. Full stop. Propolis is more of these resins. Those are more insoluble. Those are more complex carbohydrates as well as proteins. And so that's a little bit different.
Okay.
But still, they're not using that. They're using this MEL anyway. The MEL, could it be fermented by microbes to produce the acids? Of course it can. It's a fermentable sugar. So yeah, it's a problem.
I know you said this, but I just want to reiterate. In the US, you absolutely can't have sugar in oral care products.
No.
That's correct, right?
Yeah, that's correct. And the reason is because we already manifest, everybody does, bacteria species that readily ferment those that produce the acids that lead to dental caries. So from a disease perspective, you can't use a product to help combat that very instance and put those agents that would be used to do this. But this is going to be a problem And we're going to come back to lactobacilli because that's one of the major fermenters of sugars in a moment later on.
But they do claim it, quote unquote, restores
Oh, God.
periodontal tissue.
I just wonder what periodontists, if they haven't listened, they need to listen because this is incredible, right? Of course, Mel works to restore your periodontal stuff. You can do all this stuff. You have deep suckle pockets where. No. So the end result is no, Mel is not the answer to your perio problems.
Okay, we're going to move on. The next main ingredient, vitamin C plus vitamin E, wow, helps prevent canker sores and relieves oral discomfort.
Yeah, so both are preservatives, and vitamin C is generally added for water-based systems, but while vitamin E for oil-based systems. It's not really a microbial thing. Vitamin E is added for an antioxidant, okay? Maybe up to 0.3%. Now, the issue of adding those to a formulation isn't a big deal, but the claim language is because the OTC monographs for canker sores or for oral relief discomfort
Right.
do not include vitamin C and vitamin E. So, no, that's a bad claim.
Wow. Okay, so you're going to love this main ingredient. Lactoferrin, their claim is crazy. Enhances tooth hardness and acid resistance. No.
The claim is a lie. It's false. It's misleading. All of that. We'll explain that in a minute. But let's go back to lactoferrin. So, lactoferrin, you can add that into a formula. There's no problem with that. In fact, lactoferrin is naturally found in our saliva. Our glands secrete that, and it's for anti inflammatory purposes, and it might even have some antimicrobial benefits. It seems to work well with lactobacilli. So that's one of the proteins that might help support the lactobacilli in the oral environment whenever it's kept at a reasonable level, right? We don't want overactive, opportunistic lactobacilli because then we get the dental caries. But here's the interesting thing about lactoferrin. It's derived from milk, specifically from colostrum. And so if somebody has a dairy allergy, again, for this company that also is promoting allergy-free products, they should actually list on the packaging, look, this contains a milk-derived ingredient. If you have an allergy, you should pay attention to that. So I think that's one of the issues. Now, lactoferrin, it almost acts like a chelator because it really likes to be able to attach to metal ions like calcium and iron.
Okay.
This could become a problem in a little bit when we talk about some other ingredients.
Okay.
But let's just see.
But specifically, what about their claim? And I quote, and I'm going to read it verbatim. Enhances tooth hardness and acid resistance, helping to prevent tooth decay.
Yeah.
End quote.
Yeah, what is the only ingredient that's allowed by the OTC monograph?
Fluoride.
Fluoride. Here in the United States, it's only fluoride. This shows that again, these products are likely made outside the US. Again, not trying to throw shade on that. But if you are in the US market, you must play by the US rules. Otherwise, what stops anybody from launching any product and saying, hey, it could do wonderful things? We can fix perio problems. We can do all kinds of things. It's really a bad form to do this. So no, fluoride is the only anti-caries agent approved, recognized by the FDA, and even the American Dental Association supports this too, right? So you also have that association. You cannot get strengthening, acid resistance, and preventing decay claims based on anything other, than fluoride. Fluoride is the only one. Anything else, you're playing with fire, and you're wrong. You're blatantly wrong, misleading. So.
You're actually breaking the law.
Yeah, well, it is breaking the law, so yep.
It's so far. Okay, so now for the rest of the ingredients. Again, there's absolutely no confidence that these are even listed in descending order,
None.
right? And there's even less confidence on my part that the product actually contains the rest of these ingredients, but because of all the inconsistencies we saw with the toothpaste. But we'll continue with the mouthwash. And it has the following ingredients. Oh, but I'm actually surprised pleasantly. Water is the first one, which you would expect to see.
Which you would expect.
Mouthwash.
Yeah, it is the base here. It
Okay.
looks like, and it's probably 75%. Now, I'm saying this, but let's remind or let's actually describe to the listeners because they don't have the website right up in front of them. These mouthwash formulations are done in like these tiny little packets. It's almost like they're travel packets. So it's not like your big bottle Listerine that we've talked about before.
Okay.
These are very tiny packets that you would have to cut open. They're obviously opaque. You can't even see the color, so you don't even know what color it is. And you don't know what it looks like, whether it's transparent, whether there's turbidity in there. We don't know. And it's maybe done like that on purpose. You never know. But These are small, pre-measured out mouthwash, one-shot thing where you then take it, you swish it, and then you expectorate it. I don't know where you're going to expectorate if you're not around a sink, but that's another issue. They like to advertise that this is good anywhere you go. You can just travel, but it's not always that simple. Now, the packet's obviously smart for travel. We have to have I want to have that kind of picture in the minds for the
Right.
listeners because some of these other ingredients that we're going to be talking about, if I'm not mistaken, could lead to some other issues too. So.
Okay, then we'll keep that in mind. So the next one is sorbitol.
Yeah, so that's the humectant sweetener, very similar to the glycerin and the sorbitol that was used in the toothpaste. But here, I doubt that it'll get up to 20%. Maybe it will. Depends on all the other ingredients and what levels that they're using. And because we don't really have a ton of confidence, like we don't know how much lactoferrin was in there. Was there
Right.
1%? Who knows? Was
What
there
order
zero point
they
0.1?
in?
They had vitamin C and E, and then they also had the mel. We don't know what the levels are because they're not following the right format, right? For listing
Well,
that. But
right.
the point is they do have sorbitol. It is a humectant and sweetener. So there
Okay.
you go.
Well, and you mentioned the next one. So the next ingredient listed is glycerin.
Yeah, same thing. I doubt that it would be up to 20%.
Interesting. The next one is erythritol.
Yeah, so this is a sugar alcohol, very similar to the xylitol and sorbitol. So this would typically be found in your Truvia
Yes.
brand of sweetener,
Yes.
which contains stevia and is backfilled by erythritol because it's likely cheaper.
Right.
To get stevia, from plants, it's not a really economical process. Sometimes you can tease E. coli bacteria to actually produce this. That's all part of the
Interesting.
bioengineering. Cargill does this very well. They can even do that with the erythritol as well. So
Okay.
not only stevia, but they can do this with other ingredients. You can do this with citric acid, and there's some different things. So there's a lot of creative bioengineering that
Okay.
goes in behind the scenes that we'll never hear about. We're just going to open up a sweetener pack and put it into our coffee or whatever else. But here, erythritol is present, maybe a few percent at most. It's probably doing it for sweetness. Now, this would differ from like if you see, like I like the Monster Energy drink, the one that's all white. It has
Yes.
a lot of erythritol. That one, obviously has more erythritol. But if you're trying to look for a map of taste,
Okay.
without
Yeah.
necessarily having to have stevia with it in the sweetener, the Monster Energy drink. So Monster up.
You don't always need that though, trust
No,
me.
probably not.
Okay, the next one is PEG 40 hydrogenated castor oil, which we've talked about before.
Yeah, so, we've seen this in some of the mouthwashes. Usually, I like to refer to this as more of a legacy type of surfactant, kind of emulsifier. Really, the poloxamers, I think, they do a better job sometimes in working with certain formulations that may have active ingredients. So, like PEG 40, got to be careful if you're going to add that to acetylpyridinium chloride. You
Yes.
should also be
Okay.
careful with poloxamer as well, but the PEG 40 is charged and the poloxamers are not. So there might be another reason for adding this PEG 40, and I don't know why. Maybe we'll learn that from some of the other ingredients, but it does have better foaming than a poloxamer, and it can help boost foaming of other ingredients that already have a tendency to foam.
Okay.
So whether that's like a surfactant or whether
Mm-hmm.
it's another ingredient, we do have a surprise ingredient that we'll talk, I think, in a bit here about.
Okay. This one I don't really see that much. Hydroxyacetophenone.
Yeah, this is a preservative. Yeah, we don't see this too much in the oral care space, Maybe it would go better topically, who knows? It's a preservative in its own right, but it can also help boost other preservatives. And so why it might be found in other topicals is because maybe those have a higher pH. You never know.
Okay.
And so maybe it needs extra boosting. That being said, I don't think that this mouthwash has a high pH. We'll get into that in a minute, but I think that it's there just to make sure that we don't have contamination. So sometimes people would like to use maybe sorbics or like sorbic acid
Mm-hmm.
or potassium sorbate or maybe benzoic acid or sodium benzoate or maybe even benzyl alcohol. They're opting here not to use those, but to use this hydroxyacetophenone and probably no more than a half a percent. I'm probably even overstepping that. Just because, again, I think this mouthwash is acidic. The more acidic it is, the less you have to compensate with your preservative systems.
Okay. So
So,
you're saying that's uses a preservative, kind of supplanting some of the others that we've talked about
yeah, that's
before.
right.
Okay.
Mhm.
So the next is one of your favorites, which kind of confuses me, Paloxamol 407, because that's not usually used with PEG 40, is it?
Yeah, not generally. You would use those two in combination, especially if you're having a hard time solubilizing certain oils. So, like if you
Okay.
have maybe somebody struggling with a certain flavor oil system, maybe there's some essential oils in there that are giving a hard time, or the essential oils themselves are dissolved in like terpenes or alcohol or something. I don't know, something
Which can
that
certainly mess up a
that can
formulation.
mess up a formulation. So maybe that's one of the reasons why you use both. But the poloxamers are awesome. They are a little bit more expensive than your PEG 40s, but you get better results. I mean, they're more neutral. They go better with active ingredients. There's less foaming. Oftentimes, those are really important characteristics, really,
Yeah, you like
that
working with it.
consumers are looking for. Yeah, I mean the poloxamers, you're going to find them in probably some of your legacy brands that know how to make formulations. So look for those, you know. But whether it's in toothpaste or even mouthwash,
Okay.
excellent systems.
Okay. Okay, the next one confuses me a little bit because we talked about sorbitol, we talked about erythritol. Now we have xylitol. So that's like the
Yeah,
third sugar alcohol.
yeah. So I think xylitol again, I think it's all contributing to this flavor profile, the sweetness profile that they want. They go hand in hand, the sweetness, you know, with the flavor. I'm thinking maybe up to a couple percent. And sometimes companies do this. They will add the xylitol because they don't really have another good alternative for a sweetener. Like maybe they don't want to use sodium saccharin. Maybe they don't want to use sucralose, but they want to still have some kind of sweetness
Okay.
based on whatever formulation. Here, they have at least erythritol and xylitol, and I'm guessing both of those are for sweetness purposes. If they are used for humectant purposes, then the level will go higher,
Okay.
maybe up closer to maybe 10% and stuff. But if that's the case, then you got to pull back on the sorbitol, got to pull back on the glycerin. It's all a balance.
Right.
So, yeah.
Okay. I haven't heard of this one before. Domethane bromide?
Yeah, domethan bromide. So this is a really interesting one. This is one of these legacy ingredients that had been considered for inclusion into the anti-gingivitis, anti-plaque monograph, the
Okay.
2003 published one, which is still pending, but you know, it's that one really kind of established the rules for cetylpyridinium chloride, stannous fluoride, the Listerine oils. Domethan bromide was, I think, considered, but then it was pulled at the last minute. And so you don't see this ingredient in the US very much. This is outside the US. It will have similar characteristics to cetylpyridinium chloride, meaning
Okay.
it can have anti-gingivitis benefits. It is cationic, you know, and it's going to have, therefore, then some antimicrobial benefits if it has some anti-gingivitis. Might help with glycolysis, definitely bacteriostatic. But the problem, just like what you have with CPC, you got to make sure that it's bioavailable. And some polymer
Okay.
systems, some surfactant systems can inhibit that. Just like some of the poloxamers and PEG 40s can reduce the efficacy of CPC,
Mm-hmm.
which again is allowed. Similarly, it could do that to this domethylbromide bromide.
Okay.
And so we don't really know. Now, they're not listing that as an active, so we don't know what the actual level is. Even we know what their main, you know, are, and none of them are allowed. But I think that they're using this ingredient, this domethylbromide bromide, as a preservative kind of like
Okay.
because then they don't have to worry about it. But still, the point is with the PEG 40, with the poloxamer, these ingredients can and will inhibit the action of CPC and domethylbromide bromide. So
Which you say is similarly charged.
similarly charged, that's right.
Okay.
So I would be concerned about the potency of this formulation. Of course I would be, right?
Well, there's a lot of concerns. The next one is disodium EDTA. Hey, this was used in the Live Fresh toothpaste that we
So
just talked about.
yeah, it's back again, and the EDTA, you know, you can use that, you can add that to your formulations, but you have to be careful because it's a stripper. It strips minerals, just like you advertise. You know, whenever they showed the advertisement for the penny, how penny clean was that?
Yeah,
You know, it
it
was
stripped all the gunk off of
stripped
it.
all the gunk off. Yeah, it shined it
I
up
don't
good.
think I want that for my teeth,
I
though.
know, because EDTA, just like some of these other ingredients, including lactoferrin, even, or even sodium phytate, we already talked about that. These are chelators. And so they're going to claw and they're going to grab a hold
Okay,
of metal ions, whether that's iron, whether that's magnesium, whether that's calcium.
that's a problem.
And if you don't have something to help arrest that or mitigate that stripping, that erosion, that wearing away, especially if you're toothbrushing or if you're vigorously, you know, rinsing your mouth, because it's not just a fluid there. If you're swishing hard, then you're getting a little bit of wear too, they call it.
Yeah.
Sometimes maybe with the tongue brushing up against it, your teeth are temporarily soft. If you don't have fluoride in there to help mitigate that, you're going to have some bulk loss of mineral.
And this one doesn't have
This
fluoride.
one does not have fluoride. We don't know the level. It could be up to 2%. I mean, remember, endodontists, people working with
Yes.
root canals, or they just need a clean environment. Maybe they're just working in a disease state. They're prepping something, whether it's a, I don't know, a cavity line, I don't know, whatever. They may opt to use EDTA just because it cleans everything out. It just makes it for a nice removal of unwanted
Right.
mineral in the process of trying to prepare the
It's
tooth for
standard
whatever
for them to use
process.
that in their procedure because it does
Yeah.
strip things away.
Yeah, and if you don't
Okay.
have good buffering in your mouthwash, and if you don't have an active ingredient or an ingredient that can help counter that effect, which this does not have. So
Yep.
far, it doesn't have good buffering and it doesn't have any active ingredients that can arrest that. Then there will be issues down the road with potential erosion of the tissue
Right.
if you use this. And some of that mineral is not just expected out whenever you spit out your mouthwash or your toothpaste. Sometimes it's recollected and reprecipitated along with your pellicle and part of your plaque, and it actually forms this tartar and calculus, and that's the stuff that forms in your mouth
Okay.
that the hygienist or whoever
Right.
has to clean, right? And that's
Lean
the,
in there and scrape on.
for those that have a higher pH, generally they will have more tartar. So generally those people might also have some malodor as well. It's just funny that that happens. Or they will definitely have some different notes than somebody who has a slightly more acidic pH in their mouth. They won't have as much tartar.
Okay.
They still might suffer from stains, but they just won't have a lot of tartar. Those that have the tartar and the calculus, while you may not have necessarily caries, all of a sudden you're getting more into the gingival irritation
Okay.
with the tissue. So the gum line could be affected. And again, we're saying this because whenever people use their oral care stuff, this is obviously a habit. This is something that you use over time.
Hmm.
Yeah, it's maybe once or twice, but a day, maybe more. But again, it's over time. If you keep on doing these regimens, and if you already have pre-existing conditions, like what if you just have very low saliva flow from medicines or
Right.
from or whatever the reason? Maybe you're
Exactly.
just dehydrated because you were just sick, or you exercise a lot, or you
Right.
just didn't drink enough water. I mean,
Right.
very all of this stuff can be exacerbated. So
Something to be aware of.
yeah, something to be aware of. Yeah.
Okay, so this next one. Sorbitol, erythritol, xylitol. Now we have sucralose.
Yeah.
What are they trying to cover up?
Yeah, I don't know. This probably could be up to 1%. It's hard to get a good taste profile. It's an art form. There's flavor houses that specialize in this kind of stuff, and it is really hard to get a flavor profile that's going to be pleasing. I imagine that either they just did it to their own tastes, or they were like, "Hey, this sounds good. This sounds good. This sounds good." I rarely see combinations where you have sorbitol, glycerin. Those have some sweetness to them. They're not maybe as sweet as sugar, but they can be xylitol, erythritol, and then sucralose. Like that's a little overdoing it, in my view. Unnecessarily so, unless you're trying to compensate for some other kind of taste that you're trying to mask or overcome in the formulation.
So all of those are also on top of the quote unquote mel, their main ingredient, which is sugar, honey extract, right?
Yeah,
So
yeah, we don't know how much they're using there too, so that might also impart a little bit of sweetness. It might. I don't know. Yeah. So
get a sweet tooth just thinking about it. Okay, so the next one is sodium ascorbyl phosphate.
yeah, so this is interesting. We already talked about ascorbyl. That's how it was labeled on the toothpaste. This is where I think that we're talking about consistency with labeling and whether whoever's making these products are actually doing this in a registered FDA, good manufacturing practice, a GMP facility. I don't think they are. This would be one of the
That's
examples
scary.
because all of a sudden on one product you have the full name for it, and on the other product you have an abbreviated name for the same thing,
Yeah, that's
right?
scary.
FDA inspectors, and they can go anywhere, not just in the US. So for people that don't know, they readily and do travel to India or China or wherever
Hmm.
things are made, and they can inspect the facilities. I mean, if you have products sold in the US,
Right.
then that's grounds for, hey, inspections. We
Absolutely.
have to know what's going on. So the sodium ascorbyl phosphate, again, this is the version of vitamin C that they're using. I think it's probably a wise choice because vitamin C, or I should say ascorbic acid, does impart some pigmentation, and it's very acidic, right? It's
Yeah.
just it's not as pleasant as citric acid or malic acid. This is more biting,
Okay.
and you're going to have to mask that. So we're coming back down to these sweeteners, and I think that this
Okay.
is one of the reasons why they're adding so many of the different sweeteners to try to maybe map, or I should say mask, this form of of the ascorbic acid. I think, who knows what level that they're using. Maybe it's up to, I don't know, 0.5%, but maybe less than that. Who knows? But
Okay.
still, it's not approved for canker sore or oral relief
No.
discomfort, as their claims had
Right.
already
No.
referred to.
Right.
So that's right.
I mean, there's a lot of issues here, right? Not
Yeah,
just ingredients, but also claims. So,
right.
okay, the next ingredient is tocopherol acetate,
Yeah, so
which
this
I
group,
don't recall seeing in a lot of.
yeah, no, well, all that is vitamin E.
Okay.
So they went back to vitamin C and vitamin E, said it could claim, or the claims were mitigating canker sores and stuff, which it doesn't. I mean, it might help it feel better, but again, you can't establish that as a drug claim or point directly to that. So that's inappropriate there. I would think that it's probably no higher than 0.3%. Look at vitamin E added for antioxidant benefits if you have oils, and it might help with some soothing. Otherwise, you're going to have to try to fold that into the water matrix. So again, now this is going back to PEG 40
Right.
and poloxamer. Why do we have these two ingredients
Yes.
coexisting in a formulation? You do that whenever you're struggling to dissolve not only flavor oils, which we haven't talked about, but these other types of oils like a vitamin E.
So the next one, okay, this is weird. The next one is fragrance. They have to mean flavor, right?
Yeah, yeah, I'm sure, right? It's the essence of lavender, right? No, I don't know.
Fragrance and
Yeah, usually that's for topical formulations, right? Like
I
your
think
skincare or something
perfume,
like that.
lotion.
Perfumes. Oral care is not generally used. They're trying to be cute. That's fine. They can be cute, but the problem is we don't know, and we don't typically know. And honestly, manufacturers, they don't have to disclose that. The level could be up to 0.5%, but we don't know what's in there. Meaning that these flavors, it's important that the listener knows these flavors are usually pre-mixed. And so they have some form of preservative in there.
Right.
Unless it's alcohol based, where then the alcohol really replaces that. You might have a cocktail of different preservative systems in there. They might include sorbic acid, things like this that could lead to discoloration if they're intermixed with other ingredients. This sometimes happens with formulations, and then you have to mask them and by adding another pigment. Like if this, like for instance, if this would be toothpaste, you would add just more titanium dioxide, for instance.
Okay.
Oftentimes that's the case. And toothpaste is usually white. Usually it's a combination of the silica and the SLS or something like that. We talked about that earlier, but here it's the same kind of thing. We also don't know if there's parabens in there. So some people
They
really,
claim not,
yeah, they claim not,
but they
but
also claim they don't have
yeah,
sulfates and they have sodium lauryl sulfate.
exactly. So we don't really know.
Right.
Again, manufacturers, they're allowed to keep some of these flavors and fragrances as a secret, but for full transparency, sometimes it's better to actually list all of them. So, I don't know, but
Or
that
at the
just
very
that's just
least,
one of those
don't
things.
claim you don't have them if they might happen to
Yeah.
be in there.
Well, that's up to the manufacturer. So the ones that
I don't
are
like that.
they're going to be more, that will display more integrity, a little bit more honesty. If they say alcohol free, we can trust that their flavor is probably alcohol free. But you never know. And again, this company already has issues. I don't know if I trust them.
I
Just
don't. I mean,
yeah.
you keep saying they're trying to be cute. Well, they're not good and they're not right. So I guess cute is all they can go for. The next ingredient is dextrin.
Yeah, so this is strange. This is a strange one. So, people have heard about like methyl cellulose, perhaps, as a binder, microcrystalline cellulose. There's a
Yeah.
bunch of different ones. They have ethyl cellulose and methyl ethyl cellulose and hydroxypropyl methyl cellulose and all these are all great binders, and they help really try to give more substantivity to the formulation. Sometimes they can help solubility of the oils in a water matrix. However, dextrin is not used. Dextrin is much smaller than these other types of cellulose fibers. And because it is smaller, even though it's larger than a sugar molecule, it is still at risk for being fermented by oral microbes.
Okay, so this is why I haven't really seen this in any of our formulations, maybe.
Right. Yeah.
Okay.
Dextrins, you'll find this in food, no doubt.
Yeah.
You'll even find this in supplements. Sometimes people who exercise a lot, they'll take cyclodextrins because they take a little bit longer to dissolve in the GI system. And so it's believed that, hey, maybe that'll give you sustained energy while you're doing
Okay.
your sustained activity. I don't know if that works well. Maybe it does, maybe it doesn't. But here we're talking about low molecular weight fiber that will be fermentable. Is it bigger than sugar? Yeah, it's bigger than the sucrose. Remember, sucrose is composed of fructose and glucose. You won't see glucose, fructose, sucrose, or
Hope not.
lactose. You're not supposed to, unless you're this company and you sell the toothpaste that has lactose in it. You won't see that in oral care formulations because it's disallowed. You cannot have ingredients in there that might contribute to the formation of a disease like caries. What
Right.
happens with sugars?
Yeah, they get fermented and
They
they
get fermented and they
create
produce,
acids, right?
yeah, especially lactic acid. That's one of the primary acids that is generated by the action of the microbes, and that can lead to the dental caries. So these are reasons why you don't find these types of ingredients in formulations. I would include dextrin with that. Again, I could be wrong, but here in the US, it's just not done. I think that there's a risk level here, especially because you don't have any fluoride present.
Right.
You don't have anything to help, mitigate that kind of action. There's risks here.
Okay. So many problems with this formulation. Okay. The next ingredient is lactobacillus ferment. We've used this
Yeah,
previously.
that's right. You know what? I was pleasantly surprised with the lactobacillus ferment. Now, you have to be careful though, because lactobacillus ferment, it's not like you could say, hey, I just want to go to the store and or go to your vendor and say, hey, I want just lactobacillus ferment. There are many different versions of lactobacillus ferment, and some are very malodorous, and some just absolutely taste awful. Some, which is the ones that we worked with, have a neutral taste, and they are more perfect for working in those natural formulations that want to have a preservative but don't want to have a preservative. So
Okay.
lactobacillus can actually this ferment actually can function as a preservative, and it actually does very well for higher pH systems. So you're thinking maybe something around pH 6, 6.5, 7, even a little bit higher. This would be a great option. The downside to the lactobacillus ferment is that you typically have to use it at a high concentration. What is high? 4%.
Okay.
So this is a non-small amount. Sometimes this can overwhelm even some of your sweeteners. So this again could be
Okay.
one of the
Right.
reasons why they have more sweeteners introduced into the system. And the lactobacillus ferment, it foams up like crazy. So lots of foaming. And if you add something like a PEG 40 to it, which also exacerbates foaming agents,
Which they have.
which they have, then you're going to get a very high foam vehicle. I don't know if that's an experience that everybody wants. It might make you gag. You might be like, okay, I'm done with this now.
Yeah.
But
That's a lot.
those are some of the concerns. Is it good for preservation? Yes, especially at alkaline. Does that mean that this formulation is alkaline? No, it doesn't. Just something to be aware of. And who knows, they might use up to 4%. So quite a
Okay.
bit.
This is a little different for me. So the next one is lactobacillus. So we just talked about lactobacillus ferment, and now they
Yep.
also add lactobacillus. So help me
Yeah,
understand
so
that difference.
lactobacillus, so they're calling this a probiotic mouthwash. So there's a tendency, and they're not the first ones to do this, but there are others who have added certain versions of Streptococcus salivarius, for instance. They say that that might be able to mitigate some of the lactobacilli action or maybe some of the gingivitis causing species. That stuff has been around for at least 15 years and such. That might work, right? But lactobacilli, this one is a little bit more, I don't want to say unproven, but definitely undecided. And I would be really careful here because usually lactobacillus as a probiotic is ingested. You want that in your GI tract. You don't want that just sitting on your teeth.
No, it does the work in the gut.
Yeah, in the gut. But here they want it on the action in the mouth, presumably to help target those gingivitis causing bacteria, something like a gingivalis, P.
Okay.
gingivalis, which has a more neutral kind of disease state pH, whereas lactobacillus is more acidic. I don't think that's necessarily good because you already have lactobacilli in your mouth. And if you can supplement with something that will give you even more lactobacilli, there is a possibility, especially if it's at a low pH, because these lactobacilli will not survive in an alkaline environment, right? Not in a stored thing. I mean, it's better for them to be under acidic conditions or in a dry tablet, capsule,
Okay.
which is how they're usually sold for the GI
Okay.
tract, right? So here, I think that if you're delivering lactobacilli and it's in a water-based format, the pH should be amenable to the lactobacilli, so that's why I think it's also going to be acidic. So think about this. So you're introducing ingredients that can contribute to dental decay,
Right.
including lactobacillus. You have lactoferrin, which exacerbates activity of lactobacilli. You have EDTA, which strips mineral, right? As can lactoferrin.
Right.
And then you're introducing some of these ingredients that may help ferment some of that stuff, like mel,
Yeah,
like
like the
dextrin,
sugar.
so there are some issues here with this
Hot mess.
formulation. Yeah, I think that, again, if you use it once, probably not a big deal. But if you're going to be using this over time,
Most people don't use it only once. That's
then
not why you buy
there's going
something.
to be an elevated risk for whatever situation that you're going to find. And you might say, hey, your gum tissue might be fine, but your tooth mineral, your teeth might be thinning. You might be more at risk for decay. You might have tooth wear. But ultimately, if you have stuff reprecipitated as calculus, like tartar calculus, you might start having gingival issues later on. So just something to be aware of.
Okay, there are lots of issues with this formulation. Okay, so we can wrap it up the last ingredient, which is yellow 6.
Yeah, so this is an easy one, right? Obviously, for color, pigmentation purposes, we don't know the level. It depends on the source that they're getting their yellow 6 from. So it could be as little as 0.001%, could be 0.01%. But anyway, it's desired to get that yellow color. Again, it's a non-clear packaging, so I don't know what the color looks
Right.
like. It might even be pretty turbid based on some of these other ingredients that may not solubilize well. Who knows?
Right.
But that's their product.
Okay, well that was a very thorough dissection of their ingredients. It's disappointing though. I'm not happy with BodyAccel or their products at all.
Yeah, no, I think that, even if they might taste good or even smell good, and they're, obviously, it's still lipstick on a pig, right?
Yes.
And you're probably doing more harm than good. And I think it's just a matter of time. And again, that somebody's going to bring attention to them, whether that's consumer litigation, whether
Mm-hmm.
that's the Federal Trade Commission, National Advertising Division, even the FDA themselves. For somebody who is selling some of their toothpaste, so like 6,000 units a month, this is a non-small affair, right?
Mm-hmm.
So, and this is how some of the smaller brands become the bigger brands. They start doing it out, proving the market, and they say, "Hey, we have a great product that's really well accepted and everything else." Yeah, but there's a lot of problems with this. And
Mm-hmm.
prepare because you're gonna have to, somebody has to pay, eventually. So you
Mm-hmm.
might be doing okay now, and you might be excited about your progress, but look out in the future because when we say this to, even those groups, even, private equity groups that are interested in getting these kind of
Mm-hmm.
companies, they say, everybody says they do their due diligence. They don't do their due
Not
diligence to the
really.
level that they need. If anybody needs any, question about that or more information about that, just go to the Wall Street Journal. Just within the last few weeks here, there's been a number of articles talking about how BlackRock has been hosed with different deals that have fallen through, or even JP Morgan Chase, funding certain people with their thing. And then, oh, well, I guess we didn't have as many users as what we thought. So there's always going to be, and then they're
Yeah.
getting sued. So, I mean, it creates more of a headache and you don't win out in the end. You think you might, but you might not. Most of our listeners probably are not in that space, but it is something to be aware of. Just because it's marketed online does not mean that it's safe, does not mean that it's effective. Heck, even
Right.
stuff in the stores might not even be safe and effective. These are things that we're trying to educate, right, the listener on.
Right.
Whether you're a mom, whether you're just somebody interested in your oral care, whether you're a formulator, you're a scientist, you're a lawyer, whoever you are, there's not enough information out there about what is
Right.
in here. We're not
Right.
talking about the natural versus synthetic. We're talking about how are things claimed? Are they following the rules? Right?
Yes.
And
Simple,
yeah,
basic
and
stuff.
are there interactions that we should be concerned about?
Yes.
For instance, if you have EDTA in the absence of fluoride, there could
That's a
be
concern.
there could be major risk there. So anyway.
Okay, yeah, there are definitely a number of bad actors out there, and BodyAccel is definitely another one.
Yeah, and I want to thank, in closing here, I want to thank that YouTuber comment that said, "Hey, take a look at this company because something might not seem right." That was the gist of the comment, and
Because we
we
had
able to
never
do it.
heard of
Yeah, we
it.
had never heard of it. The thing about it is, there's so many companies, there's so many brands. I
Right.
mean, you could spend every day doing this. We have other things going on too, but it was important that we highlighted this. So this just again goes to show. Send us a comment or write an email, whatever, comment wherever. We will try to address those topics that we can make some sense out of and
Absolutely.
just do this. And this is just one of them. So, all right. And with that, that wraps it up, man. You've been listening to the Dental Formulators Playbook. I'm Dr. Rob. This is my co-host Tammy. Stay curious and keep smiling.